We continue our tour in apitherapy in the world, in different countries. So after China, Bosnia, Romania, Hungary, now we are continuing back to China. Today we will have Professor Liwan Yao to have a short presentation about what is the current situation in China, what kind of researchers they make in China on apitherapy, especially on VENOM studies. And then we will continue to Slovenia and then Ecuador. So now let's start with Professor Liwan Yao, if ready. And I think Dr. Stangaciu will help me in moderation.
通疗对于小儿的面瘫以及小儿防治反复呼吸道感染都有着其非常好的优势。但是作为风针疗法的话，虽然应用广泛，但是毕竟有疼痛，风针以后疼痛使得患者不容易接受，所以我们在此基础上做了很多的研究。我带领我们的博士生、硕士生，对于风针的一些不良反应以及过敏反应，都做了比较系统的、系列的一些科学研究，主要是观察了临床上的一些病人的反应，比方风针后出现的疼痛，风针后出现一些发热、瘙痒。以及一些肿胀，还有就是风疹的出现，这些我们都做了研究。比方它的频率、程度以及发生的时间，这些在我们的研究生里面都进行了系列的观察。那么除了这一点，我们还观察了很多的各种各样的疾病的疗效。你像类风湿性关节炎。我们进行了一些药物的对照，强直性脊柱炎也进行了一些针与不针的一些对照。那么还有做了一些基础研究，比方基础研究呢，用了一些比方大鼠进行关节疼痛以后造成了关节疼痛的模型，然后再进行了风针来观察它的一些免疫反应。一些关节腔里面的一些细胞的反应，这些呢都是在科研方面做了一些研究。在中国呢，做的最好的还是临床病例的观察，因为大量的临床病例的观察呢，使得我们呢对于风疗的一些规律都基本上掌握了，尤其是风针疗法。那么关于风疗呢，风针呢，我们学会的牵头呢，就进行了风针技术操作技术的一个规范研究，目的是把风针疗法的一些规范，比方说针刺的风针的刺法，我们有直刺法、闪刺法、点刺法。以及无痛风疗法，减毒的风疗法，还有一些冲击式的治法以及自动的风针法，我们都进行了规范的一些标准。这个呢，我们将在不久就会发布出来。那么关于这些标准呢，有利于全国以及世界的人。应用风针有一定的技术的规范，使得大家呢，更加安全有效的利用风针治疗。
Profesör Liwan Yao şu anda Çin'de apiterapinin önemli isimlerinden. Bir üniversitede profesör olarak çalışıyor. Çalışmalarını apiterapi üzerinde, özellikle de arı zehri üzerinde yoğunlaştırmış durumda. Çince yaptığı bu konuşmada arı tedavisinin özellikle yüz felci gibi durumlarda faydalandıklarını söyledi. Ancak arı akupunkturu dediğimiz uygulamanın yaygın olarak kullanılmakla birlikte ağrılı bir işlem olması nedeniyle hastaların zorlanabildiğini söyledi. Arı akupunkturu sonrası ağrı hastaların bu tedaviyi kabul etmesini zorlaştırmakta. Bu nedenle temelde bu konuya yönelik Çin'de pek çok çalışma yapmaktayız dedi. Doktora ve yüksek lisans öğrencilerimizi arı iğnesi uygulamalarının bazı istenmeyen etkileri ve alerjik reaksiyonları üzerinde bazı sistematik bilimsel araştırmalar yapmaktayız. Öğrencilerimizi bu konuda yönlendirmekteyim dedi. Özellikle bazı hastalıkların klinik reaksiyonlarını, örneğin arı iğnelerinden sonra ağrılarını, derecesini ölçmeye çalışıyoruz. Ve bu konuda ne yapabiliriz bunu araştırıyoruz. Ateş, ciltte kaşıntı ya da bir miktar şişlik veya kızarıklık meydana gelebilmekte arı akupunkturu sonrasında. Biz de bunlar üzerine araştırmalar yaptık. Örneğin bu istenmeyen etkilerin sıklığını, derecesini, oluşma zamanını araştırıyoruz ve bununla ilgili bir arayışımız var, çözüm bulmaya çalışıyoruz. Bunların arasında Çin'de yaptığımız çalışmalar arasında ayrıca romatoid artritli bazı hastalar üzerinde arı akupunkturunu uyguluyoruz. Ankilozon spondilit hastaları ile ilgili ilaç kontrollü çalışmalar yapıyoruz. Ayrıca eklem ağrısı yaşanan farklı hastalıklarda arı zehrinin uygulanması üzerinde çalışmalar yapıyoruz. Çin'deki en önemli avantajımız klinik vakaları gözlemleme konusunda çok sayıda hastayla çalışma yapma imkanımız var. Çünkü klinik vaka apiterapi ile ilgili bilimsel çalışmaların arttırılmasında önemli bir faktör. Ülkemizde apiterapi için bu alanda çalışmalar dünyada başı çekmekte diyor. Yapılan çalışmalarda amaç arı akupunkturu tedavisini normal akupunktur yöntemi gibi standart bir formata sokmak istiyoruz dedi. Bu alanda farklı metotlar kullanıyoruz. Düz iğneleme yöntemi gibi, ağrısız apipunktur, akupunktur, arının akupunktur olarak arı iğnesinin kullanılması gibi yöntemleri standart hale getirmeye çalışıyoruz. Standartlar üzerinde çalışmalarımızı yakında yayınlayacağız. Arı akupunkturunun belirli teknik özelliklerini belirlememiz gerekiyor ki herkes arı akupunkturu tedavisini daha güvenli ve etkili bir şekilde, standart bir şekilde uygulayabilsin diyor. Profesör Liwan Yao'ya gönderdiği bu kayıt için teşekkür ediyoruz. Umarız fiziksel olarak bir sonraki kongremizde bizzat bulunur ve kendisinin deneyimlerini bizzat dinleme fırsatımız olur. Teşekkür ediyorum. Evet, Doktor Stefan Stangaciu da bu oturumda bizlerle birlikte. Ben sözü Doktor Stangaciu'ya bırakayım.
Yes, I know also Professor Liwan Yao. She came to Europe, to Hungary, to Budapest in 2012. She's very well known in China, very famous. She worked at the university in Guangzhou, a lot of cases, and a very nice person. Thank you very much, Ali, for contacting her and bringing her to us. Yes. Now, the next will be Andrea Gandolf from Slovenia. Yes, Ali?
Evet, bir sonraki konuşmacımıza geçebiliriz. Slovanya'dan.
But sorry, Ali. Yeah, it was the translation in English done, so the people heard in English the translation of what you said in Turkish. Okay, no problem. So, yes.
Hello to everybody. I'm Andrea Kandolf. I come from Slovenia, from Slovenian Beekeeper Association. I'm very glad that I can be part of this conference. I will introduce you today apitherapy in Slovenia. In Slovenia live about 2 millions of people, and among that only 2 millions of people from the whole Slovenia, not a city, it's the whole Slovenia, where lives 2 millions of people, is also about 11,000 of beekeepers. So quite a lot beekeepers comparing to number of inhabitants in Slovenia. Usually beekeepers have about 90 colonies, so we are hobbyist beekeepers, and about 250 people in Slovenia are involved in apitherapy. We have about something more than 200 of local beekeeper societies and one national beekeeper association. And in the region of Maribor, we have regional beekeeper associations where beekeepers are very enthusiastic on apitherapy. So very powerful apitherapy section is in that region. Beekeeping in Slovenia has a rich and long tradition and is very important in Slovenia. We are very proud that Slovenia is born area for one of subspecies of Apis mellifera carnica, and beekeepers in Slovenia are allowed to breed only this kind of subspecies. No other subspecies of bees are allowed in Slovenia. Also, one of great beekeepers lived in Slovenia in the past. You probably know the World Bee Day, which we celebrate these days. The initiative to declare World Bee Day came from Slovenia, and the date that was selected for World Bee Day was the birthday of the great bee expert from the end of century. He was Anton Janša. He was the first beekeeping teacher in the court of the Habsburg monarchy at that time of Maria Theresa. He introduced some very revolutionary modern beekeeping technologies for that time, and also he wrote some books. So we are very proud that the whole world celebrate the World Bee Day and that this day is named by our beekeeper. Not only Anton Janša, also some other important beekeepers, and also Dr. Filip Terč lived in Slovenia. You probably know Dr. Filip Terč, who can we say he's a pioneer of modern apitherapy. He was actually born in present Czech Republic, and the 3rd March, his birthday, was declared as Day of Apitherapy. And he lived then and died in Maribor in Slovenia. He was a medical doctor. He graduated at Medical Faculty of Vienna. He also got their master degree and PhD degree, but then he moved to Maribor when he practiced as a medical doctor, and he observed clinical improvement of his rheumatoid condition after the bee sting. He was actually also beekeeper. And then after that observation, he started to treat his rheumatoid patients with the bee venom. He kept a systematic record of the results and published that in Wiener Medizinische Presse with in the paper with title Report of Peculiar Connection Between the Bee Stings and Rheumatism. He described his experience in the treatment of 173 patients using 39,000 bee stings. In that article, he described the clinical picture of bee sting from primary rash to swelling and to secondary poisoning symptoms like dizziness, swelling, elevated heart rate. And also he was talking about getting a complete immunity after being stung with more than 50 bee stings. And also he described risk associated with bee stings, for example, at patients with heart condition. What is very important is that he described clinical picture also in rheumatoid patients. He noticed lack of intoxication signs at the first visiting at that patient, and then he noticed that the immune system builds up, but it's not long lasting. And in repeating applications, signs of intoxication reappeared. And also he was talking about development of naturally acquired immunity. His very important findings which were based on clinical experience, the development of naturally acquired immunity usually indicated a cured rheumatoid condition, and also loss of naturally acquired immunity usually indicated a reoccurrence of rheumatoid condition. His son, Dr. Rudolf Terch, also then described the whole father's work some years later. And Dr. Philip Terch treated about 658 patients, and he noticed that 543 patients were clinically cured with bee sting, and almost 900 of patients had improved clinical status, but in some patients there were failings of clinical therapy. His work was very great, and we are very proud that he did that work in Maribor. So in honor to his name, we would like to dedicate a modern API center named by him, and to build it in in next few years. One of very important, significant of Slovenia are also bee houses. In that bee houses, we collected beehives. So it's one big house with the beehives, which are open at the back side. And because in that bee houses there is quite a lot of space, we can then go into the bee house and smell and inhale the air from the hives. You can use then inhalation mask as usual, or you just go in the house, open the doors of the hives. There are at the back there are the protected nets where you are the bees cannot come to you, but you can still smell and inhale the air. Usually beekeepers have also some beds and some other things in that house, so you can come into bee house, relax, lie down, relax, listen to the bees and smell and inhale their air. Sometimes beekeepers have also some observational hives that you can also observe the bees, and also the houses can have window, and you can watch how the bees are getting in and getting out. Sometimes the houses are a little bit bigger and have a little spa center in it, also some saunas, something to relax. And sometimes also beekeepers perform honey massage in that bee houses or wax therapy. So they're very, very appropriate for apitherapy, this kind of houses. Our bee quality, our bee products are also at high quality. We have some services that helps beekeepers to protect and to improve the quality and safety of our bee products. Slovenian honey is protected on European level as geographical indication, and also we have some honeys that are they have protected designation of origin, and also we take care for other bee products quality. So beekeepers can do some supplementary activities on their beekeeping farms. Of course, they can produce primary bee products and also other products from primary bee products. They can practice honey massage and apitherapy, and also they can advise users of bee products how to use bee products for strengthening their health. Because we have no formal education for being beekeeper and also for being apitherapist, at Slovenia Beekeeper Associations, we decided to prepare a catalog of knowledge and standards for being apitherapist. We have in Slovenia, we have institutes for vocational education and training, which helps people to get a professional qualification if you cannot get it by formally school education. And these professional educations allows people and gives people the ability to perform a certain profession. You can get a professional qualification by going to school, or there are not program for that kind of qualification by verifying and validating the national professional qualification. People who are interested in apitherapy and also who wants to get a profession as apitherapist go for educational programs which can last for almost one year, and also you can practice, you can listen there some lectures and some workshops, and we teach them how to do some bee products, and at the end you go to do the exam, and at the end our institutes give them a professional qualification as apitherapist. We have also some good examples of practice on apitherapy. The Professional Fire Brigade of Celje, and now also in Ljubljana, has built an anti-strength center for apitherapy. This is an apiary where firefighters work, and in their spare time use this apiary to reduce their stress, because they all, of course, have a lot of stress in their work when they are working in serious accidents, and then they can go to that apiary, observe the bees and work with bees and stress a little bit. And our beekeepers also offers everybody who is interested. They introduce the beekeeping system, they introduce the beekeepings, and also allow people to stay in our apiaries and inhalate that air. And some of people are included in our certificate of excellence for apitourism. This is a system that we built up some years ago, and some of the beekeepers are included in that systems, and most of them are also offer apitherapy. This system will be introduced by one of my colleagues. At the end, I would like to invite you to Slovenia to see our bee houses, to introduce our beautiful country, and we can show you some of our beekeeping heritage. You're very welcome. Thank you for your attention.
Yes, it was a very nice presentation from Slovenia. We'll certainly will go to this wonderful country, very clean country, with very interesting new ideas. By the way, we'll have in October one conference on apitherapy in children and health. Yes, Professor Timuchin?
It was a very nice presentation. It is very nice, actually. Do you also enjoy, Dr. Stefan, from China and then Bosnia, Hungary, Slovenia, Hungary? So we are like traveling the world now online. And
yes.
It is very nice to hear what is happening in different countries, and also mentioning some important names. I mean, we started with Professor Fangju, but we mentioned the Dr. Terk and Dr. Beck. So it is very interesting, and it is very nice opportunity to have an online World Congress on apitherapy and seeing our colleagues now and also in the past.
Yes, it's a wonderful opportunity, and on top of it, it's free of charge. So it's extraordinary. Yes. Mm-hmm.
So who is the next speaker?
Andres Castillo, the pre-recorded video. maybe Kemal can help us to project it. Yes, very good.
Good day for
Hello to
everybody.
Ecuador.
Thank you so much for invitation. My name is Andres Castillo. I am medicine doctor and I am from Ecuador. Today I am going to talk about apitherapy statistics. My topic is comparison and clinical utility of the VENOM sensitivity test used in the treatment of the most common pathologies and their predictive value in relation to the results obtained in the medium term. The objectives of this study is to decide the difference between sensitivity tests, the clinical scopes of the sensitivity test, and the predictive scopes of the sensitivity test. My clinical sample was 120 patients without prior contact with apitoxin for at least 4 years, 30 patients for arthritis, 30 patients for osteoarthritis, 30 patients for migraines, and 30 patients for hypertension. I divided in 3 groups of study, 40 patients, 10 of each disease per group. Group number 1, I used sensitivity test using a LFB sting at 90 degrees in Dumai 14 plus minimum dose protocol with a LFB venom. In group 2, I used sensitivity test with injectable B venom less than 0.001 milligrams per milliliter subcutaneous needle number 30 in Dumai 14 plus protocols of minimum doses with injectables B venom. In group number 3, I used sensitivity test with oral B venom solution 0.01 milligrams per milliliter sublingual 3 minutes plus minimum dose protocols with oral B venom and aleve B venom. About methods and variables, I use sensitivity test using the scale of results measures of sensitivity test. It was written in Manual of Protocols and Procedures in Apitherapy. Low equal to response A, B, or C. High means equal to response D and E. And sensitivity tests F, G, H, I, and O were excluded of this study. For the results, I used the scale of clinical improvement from 1 to 9 and it was taken in the 7th session. Low, when response rating between 1 to 3. Medium, if response rating between 4 to 6. And high, if response rating between 7 to 9. In this picture, you can see the results measures of sensitivity tests, and each letter means, for example, A is lightning redness, B, marked redness, C, papules less than 1 centimeter. A, B, and C is one of the group of the response in the measure of sensitivity test. And letter D and E, D means papules plus than 1 centimeter, E, mild retropapular edema. The rest of the letters in the right, F, G, H, I, and O, were not included in the study. About the minimum dose protocol, I use this kind of protocols. All depends that the letter that discover in the measure of the sensitivity test. For example, if I discover letter A, B, or C, I make an approach, and this approach can make equal or less than elsewhere, no more than 3. For example, in D and E, suspend session, schedule next appointment after 3 or 7 days. About the results of each groups, we are going to see in the next slide. the results in each of one, and we're going to compare the results to get conclusions and recommendations. In these pictures, you can see in the left side the graphic of each group about sensitivity test. First group, you can see low sensitivity in the most of patients, less than in arthritis, that you have high sensitivity using this kind of sensitivity test. And in the right, you can see the medium-term results. For example, in group number 1, you can see that, for example, in hypertension, we have good results, better than in the other groups, and the less sensitivity. It means that it's very good to this kind of patients. The same thing in arthritis. You can see in this group that we have very good results, better than in the other groups, and with a low sensitivity. In the second group, I discovered, for example, in osteoarthritis, or osteoarthritis are the same. I have a good results using the technique in the second group with the low sensitivity. And in the third group, you can discover, for example, in migraines, very good result in medium term with a low or non-existent sensitivity. Let's talk about results in group number 1. Better acceptance of the stimulus with low sensitivity, 9-1 is the rate, and a medium result in arterial hypertension. In arthritis, the ratio is 7-3, with results at the medium level. In group 2, better acceptance of the stimulus with low sensitivity, 9-1 is the ratio, and high results in osteoarthritis. In group 3, absolutely acceptance to the stimulus without no sensitivity, ratio is 10-0, and a high result in migraines. Our conclusions. About sensitivity tests, I need to tell you that sensitivity test opens the immune system portal and determines an optimized clinical response when obtaining results with the minimum dose protocols in apitherapy. And choosing the most appropriate sensitivity test provides predictive values in the evolution of certain pathologies. About my recommendations, please repeat the sensitivity and reading tests in each session. Use the best therapeutic combinations, sensitivity tests plus minimum dose protocols to determine evolution and prognosis. For example, in migraines, process with oral VENOM and a lead VENOM. In the case of hypertension and arthritis, process with a lead VENOM. And in the case of osteoarthritis, process with injectable VENOM. Don't forget to visit our webpage in www.apimaster.org. You can see Apitherapy software, all the system inside, Apitherapy blog, products and service, training courses, events, and advices. All the questions that you have about this study or whatever you want to ask me, just write me. Thank you so much for your time.
Yes, it was a very nice presentation on the experience of Dr. Andres Castillo Montenegro. He is the president of the Latin Federation of Apitherapy. It should have been a presentation on apitherapy in Ecuador, according to this program, but Dr. Castillo was not able to send us this presentation. Anyway, it was very valuable. And I think Dr.
Maybe
Timucin,
Dr. Stefan, we can remind our colleagues that, this is a World Congress and we have a lot of presentations from Latin America, but because of the time difference,
Yes.
now probably they are sleeping very early in the morning. What's the time there? About 4 o'clock maybe?
Yes. Yes. They
Yeah,
are
so
8 hours behind us.
behind. So, but they will have their presentations just after we finish about 6 o'clock. So I would like to remind and announce that any friends of us and any participants who would like to attend to their presentations, which are very interesting actually, they can continue after 6 o'clock to attend to Falapi
Falapi Congress, yes.
presentations, yes.
Yes. Now we have the lunch break, and I believe so. And we'll meet 1 hour later. Yes. The next section is with
It's
James.
2 o'clock.
Yeah.
Yeah, I think we will continue with other countries. Do you know which countries? I think
It's
it's
UK, and then with James Fernley, and then India, Pushpendra Singh Bhandari, and hopefully with Dr. Kleronomos from USA.
okay. So if there is any question, maybe we can answer. Do you see the chat section?
Yeah, I looked. It were congratulations, many congratulations for this Congress, but I didn't see any specific question on panelist.
Okay. So therefore we can have a break and continue at 2 o'clock.